now, you got middle as in mediastinum. That's what's going to hold the heart, and then the upper mediastinum is going to hold the great vessels here. So, you can see it on the torso models. Well, right that one right there, the heart's missing out of it. That's the mediastinum. The ascending aorta, very simple. The aorta is coming off the heart. This is the ascending aorta, the part that goes up. The part that arches over and curves is the arch of the aorta. The part that goes down is the descending aorta. Now, once it gets past the heart, they give it a bunch of other names, but don't worry about that. We're not going to do that till blood vessels. We are covering the heart's vessels here instead of in the blood vessels because it kind of ties everything together. So there's the ascending aorta. The apex of the heart is this pointy end. This is actually the end that points down and to the left in the actual human body. Depending, sometimes the heart can be, people who are carrying too much weight can actually have their heart turned horizontally. Real tall, thin people can actually have vertical hearts. But basically, for most of us, it's going to be just like that. Okay. We already did the ascending and the aortic arch. The base of the heart is going to be this part right here. In other words, the area where the great vessels come from. I know you think about apex as being the top, but on the heart it's going to be exactly opposite. The apex is the pointy end at the bottom, the base is the flat end at the top. Coronary sulcus. Okay, guys. On this heart model, it's hard to see. You see all these blood vessels that are going down on this side of the heart? Yes? Okay, these guys are sitting in like a little groove like that. So you got a blood vessel here. They're sitting in like a little groove like this. Does that make sense? Kind of like it's edged out. That's the coronary sulcus. It's just a place for these vessels to sit. Endocardium, myocardium, and pericardium. That's just the three layers of the heart. We'll see this better in the lecture class, but I'll go ahead and do the thing. Endocardium is the innermost layer of the heart. You've got to be careful about this because these guys have got names. But I don't know if you guys can see this. But this layer is called the endocardium. In the middle is the myocardium. It's the actual muscle of the heart. And over here is the pericardium. This is also known as the visceral pericardium. But we'll just stick with pericardium.
Can you point this way to it?
Endocardium, myocardium, and pericardium. And that's exactly what we've got here. The myocardium is a very thick layer, it's muscles. The pericardium is really just connective tissue that's going to be, it's the same thing as the visceral pericardium, because it's going to turn around and you're going to have a parietal pericardium that is next to it. All that is from A&P1, so if you don't remember that, go and check it out. Well, that's the interventricular sulcus. This is the coronary sulcus. I'm sorry. Actually, coronary sulcus is right here. Hold on, guys. It'll be easier to see on this one. If I turn it like that, can you guys see that groove right there? Right there. The groove where the heart muscle dips down, kind of like a little drainage ditch, but it's just a place. So that's the interventricular, where are we on now? Septum. Oh, that's not the septum, that's the sulcus. This is the interventricular septum. Septum means wall, right?
Where is it at?
Hold on. wish we had lecture first, and I wouldn't have to go through all this. Cause I explain all this, okay. Let me draw it first, guys, so it makes more sense. So there's the heart. There's the wall of the heart. The heart is divided into 4 parts. There's 2 on the upper and 2 on the bottom. Okay, these upper guys are called atria. You ever seen a house that had an atrium? It's just a doorway that leads into the house. That's what this is. This one is on the right side and that one's on the left side. Okay, the atrium actually have a doorway right here that leads down to the lower 2 chambers. This one is the right ventricle and this one is the left ventricle. The wall between them, which is composed of muscle tissue and some endocardium, that is the interventricular septum. The wall between the 2 ventricles, that's what it means, right? Everybody with me on that? Superior vena cava. Superior vena cava, this is the way blood flows back into the heart after it's been to the body. Superior means it's on top of it. So this is blood that's coming from everything from here up. Basically your head and neck and part of your upper chest. On the bottom, you can't really see it very well, but there's also the inferior vena cava. All the blood that's coming back to the heart from the rest of the body goes through there, okay? Right and left auricle. Okay. These are the atria. There's the left and here's the right. Now, you see this little part right here that's shaped kind of funny, kind of scalloped out? You've got the same thing over on this side. This guy right here. They look common, kind of like flaps, only they don't really open. Those things are called the auricles of the heart. This is the right auricle, this is the left auricle. Auricle is another name for ears. Somebody who saw that said, hey, that looks like ears. All right, so we're stuck with it. But since we don't do things simply, we'll just give it a Latin name or a Greek name and confuse everybody. This is the auricles. But inside here is the atrium. The atrium is the space. Okay? You follow me, guys? We're going to quiz on this next week. Okay. We did the epicardium, the visceral pericardium. The inferior vena cava I've already showed you. Trabeculae carneae is this stuff. Do you see all of this right here? Now, I know if I ask you what that layer was, you should say endocardium, right? Because we just talked about layers. But if I ask you about this surface feature, you would say trabeculae carneae. That's one that's easily misspelled, by the way. So make sure you spend a little bit of time with that guy. That's trabeculae carneae. They have got this list all out of order, but that's okay. We'll come through anyway. Pulmonary veins. Missing the parts of those. There it is. Pulmonary veins. Now, let me give you a real big hint. Most of the time, in models and on diagrams, they show arteries as being red and veins as being blue. But that's not always the case. the blood that comes back from the lungs to the heart, even though it's kind of anything that comes to the heart is a vein, anything that leaves the heart is an artery, okay? That's how we define it. These guys are red. They're red because they're carrying oxygen-rich blood from the lungs. So these are actually pulmonary veins. This guy right here, that's called the pulmonary trunk. He's going to split in two because you got lungs on both sides of the heart. So we have to take him to the back, and then he's going to send one pulmonary artery to the right lung and one to the left. He's blue, but he's not a vein. Memorize that. Don't forget it. It'll trip you up if you do. Huh? That's, these are the pulmonary veins, even though they're red. These are the pulmonary, this is the pulmonary trunk. These are the pulmonary arteries, even though they're blue. Because any vessel that leaves the heart is an artery, any vessel that comes is a vein. We show red to show oxygenated blood, and blue to show blood that's deoxygenated. These guys are leaving the heart, but they're going to the lungs because they have no oxygen. They need to be booted up. Does that make sense, guys? Just one of those things. Let's see. Right atrium we already did, but I'll do it again. It's this guy right here. Left atrium, I don't think we can get in there on this model. Well, here they are. Right atrium, left atrium. Now, what else we got? Pulmonary trunk, I've already showed you. Left atrium, already showed you. The one on the left side. Let me give you a great clinical pearl. I used to watch the Three Stooges. They did this all the time. Okay, I want you to point to your right. Point to the right. Where's your right at? It's over that way. When you look at the heart, or when you look at your patient, please remember that his right or her right is going to be on your left. So when you look at this model on a test, that's the left atrium because it's on my left side. Ooh, you just missed it. People miss it based on that. And I've seen nurses in the hospital get this wrong. The patient has a scar on the left side. No, the patient has a scar on his right side. It's your left side as you face him. So, you've been warned. Let's see. The left and right ventricles, we'll go ahead and go through those. The ventricles are the bottom part. This is the left, this is the right. Now, valves. As long as I'm doing this, I might as well go ahead and do these valves. The right atrium and the right ventricle are separated by a wall, but there's a hole in that wall so that blood can go from the atrium to the ventricle. It has to, right? This guy is called the tricuspid valve. Kind of opens up like this. On this side, from the left atrium to the left ventricle, they have a valve too. And that valve is called the bicuspid. More often, it's commonly referred to as the mitral valve. All this is, guys, is a pathway. There is the tricuspid right there. You can see it's just a hole that lets blood go from the atrium into the ventricle, okay? That's it. So we did tricuspid, we already did the left ventricle, we did the bicuspid. Chordae tendineae, see, we did the trabeculae carneae. Chordae tendineae shows up better on this thing. You see these things that look like strings? that are attached to the valves. So when these valves close, these valves are going to close right there. These guys, these are what are known, basically these are the heartstrings, poetically. These guys are going to keep that valve from blowing out the other way, because these things are pretty flimsy, and so when this guy starts to squeeze, in order to keep this guy from blowing upward, these heartstrings are going to hold him back. How do they do that, I hear you say, or you should say anyway? Because these guys are attached to yet another feature, papillary muscles. See if I can find one. Oh yeah, there's a lot of them in here. There's a papillary muscle. The thing is torn off, but so basically, when this bottom part of the heart starts to squeeze, this muscle pulls these tendinae tight, and that tightness keeps this guy from blowing upward and out into the atrium. That's what it's all about. We're going over this in lecture, guys. I don't want to do too much physiology, just enough to try to help you understand what these things are for so you can memorize them. Okay. Chordae tendineae, the pulmonary valve, papillary muscles. Pulmonary valve we hadn't talked about. Okay. So, we know how the blood, okay. The vena cava is going to bring blood into the right atrium. That's what it's for. Blood's coming back to the heart because it's low oxygen. It needs to get booted up. We already saw that blood is going to leave the right atrium to go to the right ventricle. Good enough. The pulmonary artery, the pulmonary veins that we talked about are bringing blood back to the left atrium. From the left atrium, that blood is going to go into the left ventricle because we already talked about that valve, right? Okay, so we got the blood in the ventricles, but it can't stay there. It's got to get out of the heart and go someplace. So that means it must have a door, right? Does that make sense to you guys? Sure. Okay, the door that goes to the pulmonary trunk that we just talked about is a pulmonary valve. It's not a real big deal. I'll show it to you. Let's see, there it is. Pulmonary valve right there. So this is how blood goes from the right ventricle out of the heart to go to the lungs. It uses that doorway called the pulmonary valve. You might as well go ahead and jump on it. So blood comes back from the lungs, goes from the atrium to the left ventricle, and then it's got to leave and go out to the rest of the body because that's what its job is, right? So it's got a door too. Its door is right here. This one is going to leave the heart and go into the aorta that we just talked about. I bet they call this the aortic valve. Real hard to do. That's it, seriously. That's all there is to that. Let's see. Okay. Now times to do the veins and arteries on the heart. Let's see. Let me look at the thing. We may have a little bit more time to do this. If we do, then I'll try not to blow you guys away with too much at one time. Let's see. Yep. I've also got Tuesday of next week to do this. So let's say the arteries